Welcome back to Career Hunters, and another way that Riverside Health System finds their way into your home with healthcare services is through physical therapy. And I'm joined by Jacinta, who is a physical therapist assistant, and her name means hands of fire. Is that correct, Jacinta?
Yes.
What type of patients do you see in their homes?
We see patients of all ages, from young adults to elderly, with just different types of ailments.
And Jacinta, forgive me, I was supposed to bring our dummy Annie with me so you could do a little demonstration. So we kind of voluntold our crew member, one of our crew member, Carl, he's gonna stand in. He has a hurt knee. Carl, could you limp over here for a minute? And I understand, Carl, that you were running away from your girlfriend and tripped. Is that how you hurt your knee?
Exactly.
Oh, I'm sorry to hear that.
She wanted to play with my hair, and I wasn't about it.
Gotcha. So Jacinta, you're in Carl's home here, and first of all, you love the chair and his decor. What is the first thing you're going to do to him?
So the first thing I'm gonna have you do is tie this band around his knees.
His throat? Is that? Oh, I'm sorry. Around his knees? Okay.
Yes.
All right, Carl, here we go. Okay. Tie it.
And then I'll have you bring it above. Yeah.
Okay, above here.
Mm-hmm.
Do I tie it
and
off?
tie it in the bow. Yes.
A bow?
Mm-hmm.
Wow, okay. Is it too tight, Carl? I want you to be comfortable. It's very important that Carl,
Seems good.
our stand-in dummy, is comfortable. Okay. All right.
So one of the exercises we generally instruct him in, and that's a good bow you did, is I'll have you bring your feet together, Carl.
Mm-hmm.
And then we're just gonna open and close at your knee 5 times.
Oh, man.
And then I want you to open them as wide as you can get them.
How important is it to continue your physical therapy?
It's very important, because on the days that we're not here is when our patients make the most gains, is, continuing with the exercises.
Interesting. And a lot of times people will say, well, I feel fine and I've already done the physical therapy, and they kind of cut it short, but that's not a good thing.
No, so we're gonna move this down, but I want you to bring your feet down. There you go. What I want you to do is straighten your feet. And then I want you to kick your foot up towards the ceiling. It is very important not to quit doing your therapy when you're doing it, because it just continuing exercise, just keep your strength up.
Carl, how you feeling?
I already feel the strength.
Okay, that's fantastic.
Okay, now we will untie the bow.
Okay. This is very hands-on, by the way. Oh no, oh no. We've run into a problem, Houston. Let me just drop it down. Here we go.
There you go.
All right.
And another exercise without this is just marching. You'll just have him bring his knees up as high as he can while he's sitting in the chair.
Oh wow, look at that. That's good. Good dexterity. How's that old football injury doing?
That's good.
You did a great job.
All right, is there anything he can do standing up?
Yes, so.
All right, Carl, stand up. I'll help you. There we go.
One exercise, he can do kind of the same thing standing there, just bringing your leg up. There you go. Another one he can do is you can have him demonstrate stepping to the side. And so those are just a few of the things we would have somebody do who had a knee injury.
And generally, how long are you in a home for each patient?
So it kind of depends on the complexity of the patient, but a minimum of 30 minutes, the max about 45 to an hour.
All right. Well, Jacinta, you've been fantastic. Carl, nobody does a dummy better than you.
Thank you.
Thank you so much. Well, you can imagine all the coordination needed here at Riverside with the homes and the patients and the care. Now we're going to talk to someone who puts that all together. So with all that Riverside does to provide in-home care, I can't imagine the coordination it must take to do the job. So I have the expert, Cherilynn, to tell us how to even begin all the coordination.
Thank you for having me. Our referrals come in through our electronic medical record system, and we have schedulers that work on the therapy side and the nursing side, and together they help determine which is the best person to go out and see the patient first. Once they figure that out, based on what the patient's needs are, the therapist or the nurse will call the patient, set up the appointment, and determine when they're going out to see the patient, set up the program, and then they go from there.
I bet your calendar on the refrigerator at home is just perfect.
It absolutely is.
Now, Cherilynn, how long have you been doing this job?
I've been with Riverside since 2015, so 7 years and counting.
7 years, fantastic. And who makes a great candidate for this position or a position working in the home?
Right. So we really want candidates that live up to that Riverside mission, which is to care for others as we care for those that we love. So we're looking for that compassionate candidate, that dedicated candidate. We're also looking for that resilient candidate because it takes a lot to do what we do. It's not for the faint of heart, but it is so rewarding.
Is it a flexible position?
It is. It really is flexible. So, and that's what draws people to home health. But I tell people flexibility goes both ways because we're in the patient's home. So we have to remember that as well.
Absolutely.
Yeah.
Well, thank you so much for doing what you do here at Riverside. And thanks for being on the show.
No problem.
Thank you so much for watching Career Hunters, and a big thank you to Riverside at Home. To reach out, contact them at riversideonline.com/careers or call them 757-534-JOBS. Remember, you can watch all our episodes on yourview.com. Thanks again for watching Career Hunters, your one-stop shop for everything career related.